Hello everyone. Can we start, sir? Shakti. Okay, we'll begin. It's 9:01. Good evening to the session. Um, just to give everybody a little bit of a brief about me, my name is Priya and I'm from Bangalore, 21 years old. I work full time in the bank, and the reason I'm associated with Health Quadrant is because I want to start making a difference in the world and get people to change their food habits, their lifestyle, and their overall well-being. And I think being associated with the community like Health Quadrant, whose vision and mission it is to transform 1 lakh lives by 2030, is a great start to this, whereby we're all making small steps to change the world. So that's a little about me. Now, I want to quickly introduce our speaker for today, um, Samita. So, she's a certified dietitian and nutritionist, and she's a dedicated advocate for health and wellness, believing that well being should be for all and everybody deserves to treat their body with love and care. And she also provides consultations for people with conditions such as diabetes, digestive disorders, cardiovascular diseases, thyroid issues, and PCOS. And in addition to therapeutic nutrition, she also has skills in sports nutrition, vegan diets, and also keto diets. So we all are here today to learn from her and her expertise. Over to you, Samita.
Hi, good evening, everyone. Welcome to the show, and I'm so glad you all took out the time and be here with us today. Today, we'll be talking about a topic that is very close to my heart, and that is diabetes type 2 and how it can be managed through nutrition and exercise. On a Thursday evening, why are we even sitting here talking about diabetes? Why aren't we going out? Why aren't we doing something else? Sometime back, diabetes was declared as India was declared as the diabetes capital of the world. Is it something to be proud of? No, I don't think so. I am genuinely scared. I would rather be top of anything else rather than diabetes. I would rather be off this list. So, but what does it mean for us? It means out of 5 people, 2 people out there are suffering from diabetes. And if we count the number of pre-diabetics and the kind number of people who have not been diagnosed, it would be a staggering amount. So we should really look into this. And through nutrition and exercise, we should make sure that we get rid of this list and we are a healthy and happy nation. So there are a lot of factors that contribute to diabetes. We'll be talking about a few of them. One could be our genetic makeup. Second could be our environment, the toxicity, the pollution. Third would be the food we eat. Fourth could be the lifestyle we lead. Then it could be smoking, drinking, and the kind of food we eat, and stress, and of course, lack of sleep. All these factors play a part here. Let's touch base one by one. Okay, so genetic makeup. So I have people who come and say that, oh my God, my mother is diabetic or my father is diabetic. What can I do? Sorry, you can do. You can do lots. First, begin by being a dedicated person. Begin by understanding your body and being disciplined. Learn what are the foods that are good for you and follow a strict regime. So, like my teacher used to say, genes loaded the gun, but it's your lifestyle that pulls the trigger. तो आप अगर चाहते हो और ठीक अपनी लाइफ रखते हो, आप ठीक से खाना खाते हैं और आप मीठा पे कंट्रोल करते हैं या जो डॉक्टर कहते हैं वैसे चलते हैं, तो आप डायबिटीज अवॉइड कर सकते हैं. आपको जरूरी नहीं कि आपके अगर पेरेंट्स को डायबिटीज होगा तो आपको भी होगा ही होगा. Okay, then let's come to food. So food plays a very important part in diabetes. It has a huge role to play. The thing is, what is diabetes? Diabetes is the inability of our body to digest or metabolize carbs. And the irony of it is that our main food is our rich in carbs. So what can we do? Is there nothing that can be done? Of course there is. There is so much that can be done. All we require is to change our food habits a little bit. Slowly and steadily, we can get there. So now when we put a plate, what we see is there's carbs, and there's a little bit of vegetables, and there's a tiny bit of protein. So now what do I think a healthy plate should look like? A healthy plate, half of it should be veggies, green veggies, and 1/4 of it should be protein, which we Indians are definitely lacking in. And rest 1/4, the last priority should be carbs. I'm not asking you to cut carbs out of your system. No, please no. We can go on a keto diet, which is very low on carbs, but I don't think it's sustainable. So yes, please go ahead, eat your carbs, but eat in moderation. So when we are talking about vegetables, there is so much to eat. But then again, vegetables also, when you have diabetes, you have to be eating the non-starchy vegetables in a larger quantity. So what are non-starchy vegetables? Oh, we have so many. There is methi, there is spinach, there is broccoli, there's capsicum, there are bell peppers, there's bitter gourd, there's bottle gourd, there's tori. There is so much to eat. In salad, there are carrots, there's lettuce, there's cucumber. So these are all vegetables which you have, your body will be thanking you. Then let's come to protein. See, Indians need to have more of protein. If we check, most of us are deficient in protein, and diabetics especially. In diabetes, it's not only our body's inability to metabolize carbs, it's the body's inability to metabolize fats as well as proteins. So slowly and steadily, a diabetic patient loses a little bit of mass. So then they should be very careful, and they have to up their protein intake. So now, then 1/4 portion is carbs. Okay, so now let's talk about what kind of protein. So non-vegetarians, fish is great for you. You can have fish, you can have chicken. And for vegetarians, have dals, have rajma, have chana, have kala chana, anything that your body suits you. So to manage diabetes, we just have to change our mindset. A low carb diet with a lot of green leafy vegetables and non-starchy vegetables. What are non-starchy vegetables? We just spoke about. So what are starchy vegetables? Starchy vegetables could be potatoes, it could be sweet potato, it could be rice. So these are things that we can have, but we can have in moderation. बट देयर इज अ टाइनी पॉइंटर टू दिस. अगर आपको स्टार्च वाली कोई वेजिटेबल खानी भी है या कोई फूड खाना है, जैसे कि राइस खाना है, तो आप एक दिन पहले उसको बना के रख लें फ्रिज में, और उसको अगले दिन अगर आप निकाल के गर्म करके खाएंगे तो जो आपका शुगर स्पाइक होता है वो थोड़ा ब्लंट हो जाएगा. सो इट इज नॉट दैट यू हैव टू completely throw it out of your system, but it is just that you have to manage it. So now, and one more thing, veggies, why I'm stressing so much on veggies is because veggies give us a lot of fiber. And the daily recommended allowance of fiber is 30 grams per person. And I'm highly doubtful that many of us, I'm sure many of us are not meeting that RDA. So second comes, let's come to the oil that we're supposed to have, the fat content in our body. So now the fats we can have is olive oil, flaxseed oil, canola oil, and non-hydrogenated soybean oil. These are the oils that are good for us. But one thing that has to completely go out of our system is trans fat. Trans fat is something that really, really aggravates our diabetes. So we can't have fried food, and anything. When we buy packaged food, we have to be very mindful, and we have to read the labels. Anything that has trans fat, we should not be having it. Okay, then there's saturated fat also. There's butter, there's ghee, there's coconut oil. So, by the way, coconut oil might come in saturated fat, but it is good fat for us because it has lauric acid. But then again, when I say good fat, I mean you can have it, but in moderation. So the kind of fats that are good for us, I would call polyunsaturated fats, monounsaturated fats, which we can get through like walnuts, almonds, different kinds of seeds, sunflower seeds, pumpkin seeds, flax seeds, chia seeds, basil seeds. These are all good fats for us. Peanuts, cashew nuts. Having said that they are good fat, you can't have them. You can't have a bowl of them. Everything, diabetes is managing your lifestyle with moderation. आप खा सकते हैं लेकिन आप कम क्वांटिटी में खाएं. जब तक कम क्वांटिटी रहेगी तो उतना लंबा टाइम आप खा सकेंगे, और जितना आप क्वांटिटी बढ़ाते रहेंगे उतना फिर कम लाइफ में खा सकेंगे, उतनी ज्यादा डिजीजेस होंगी. So now what we have to do is we just need to manage our portion size. We have to be careful about what we are eating, how much we are eating, and that's just about it. So protein intake is very, very important. What we eat and how we eat also is important in diabetes. So what we can do is change our macronutrient eating order. What do I mean by that? Like, how we sit down with a plate, we always sit down with our carbs, proteins, and our vegetables and salad in one single plate. What we need to do is start with vegetables. Okay, you can start with a salad and then eat protein and carbs, protein and fat, and last we eat carbs. You'll say, oh, how do we do this? We just eat roti. How can we just eat roti and rice? Okay, I can give you a solution for that also. When you start with salad, and then after 5 minutes, eat a small portion of this vegetable that you've made. And rest vegetable, then you eat your protein and fat, and last, that small portion of vegetable that is left, you eat with your carbs. Is that possible? I really hope so, because again, like I'll say, it'll help blunt your glucose uptake and it'll be very good for you. What do you think? I really hope this makes sense to you. So seeds are very, very important for us. It's a good source of fats. So we must incorporate seeds and nuts in our diet. But again, like I said, in small portions. Okay. Now, to manage diabetes, exercise plays a very, very important role. This is the third. When we're talking about a sedentary lifestyle, we are inviting this disease in our lives. Do we want that? No. We want to get rid of diabetes. And if we can become active, it's a very small price to pay for such a big problem. So there have been a lot of randomized controlled trials which have been conducted on pre-diabetic patients. One of such trials where the people were made to undergo 20 to 30 minutes of exercises every day. The results that showed it in pre-diabetic patients, 58% of them did not get diabetes. I think that's great. So why not? It's a small price to pay. We can all just be more active, give up a sedentary lifestyle. Like I would say that, sitting is the new smoking. So all we have to do is incorporate a lot of movement in our life. And then I think we can really, really manage this disease. So what kind of exercise I'm talking about? So, any kind of movement. Movement is your way of telling your body that it is alive. So, it could be walking, it could be taking a walk out in the park, it could be cycling, it could be swimming, it could be yoga, it could be Pilates, it could be stretching, anything for that matter that you are comfortable with. But you must do exercise. In diabetes, strength training also helps a lot. So you lift weights, you gain a little muscle, and it will really, really help you. It will help lower your blood glucose levels. It's all a matter of giving about an hour to yourself, and then and getting rid of this problem? Do you think it is such a big deal? No, I don't think so. So आप क्या कर सकते हैं, आप कुछ भी करिए ना, अपने लिए 1 घंटा दिन में निकालिए जिसमें आप 30 मिनट्स तो बहुत अच्छी तरह से जो मर्जी आपका करता है, बट टाइम देख के घड़ी के हिसाब से आप 30 मिनट्स की एक्सरसाइज करिए। उसके बाद आप पूरा दिन ध्यान रखिए कि आप कर क्या रहे हैं। हम लोग मोस्टली ये करते हैं कि हम लोग ना बैठ जाते हैं, हम सारा दिन बैठे रहते हैं। सो दिस इज समथिंग वी हैव टू बी वेरी माइंडफुल ऑफ कि हमको सिर्फ बैठना नहीं है, वी हैव मोर टू डू, वी हैव टू कीप मूविंग। No, don't ask your help to get you a glass of water. Get up and get it yourself. If you're in office and if you have a sitting job, make sure after every 15 minutes you get up and then you take a round and then you come back and sit. Or even generally when you come back home, take the stairs, don't take the lift, don't take the elevator. These things are really, these are small tips that are really, really helpful. Then, then there's this very small exercise. It's called the soleus push-up. ये हमारे को बहुत फायदे देती है। Soleus push-up is nothing but like it's an exercise which you can do while sitting down also. So what is it? It is you just have to lift your heels up. Lift your heels up, put them down, again lift your heels up. Even if you do this about for 4 minutes 5 times a day, your blood sugar levels will really go down. So it's a small exercise which can be done from anywhere, from any place. So please see if this is possible for you. Then when we were talking about lifestyle and food we eat and outside food, so in diabetes or a pre-diabetic condition, you cannot eat out so much. Processed food you have to be very mindful of. It'll be helpful in your life if you can limit the quantity of processed food or eliminate it. Then nothing better than this. But it has to be one cheat meal in a week. And once you eat that also, then you have to be very sure that you're walking it out. अब उसके बाद बहुत सारी एक्सरसाइज करें। कभी आपको लगता है आपने बहुत ज्यादा खा लिया, तो फिर बहुत सारी एक्सरसाइज करिए। डायबिटीज में ये नहीं है कि आप शुगर ले नहीं सकते, आप हर चीज ले सकते हैं। अगर आपका डायबिटीज लेवल ठीक है, मॉडरेशन में ले सकते हैं। जैसे फ्रूट्स खाने चाहिए आपको, डिफरेंट कलर्स के फ्रूट्स खाने चाहिए, लेकिन ये नहीं कि आप हर तरह का फ्रूट खा सकते हो। अगेन बहुत जरूरी है हमको देखना ग्लाइसेमिक लोड और ग्लाइसेमिक इंडेक्स क्या होता है। तो ग्लाइसेमिक लोड है, जिनका हाई होता है वो हमारा ब्लड शुगर लेवल्स बढ़ाते हैं। सो जैसे मैंगो है, मैंगो इंक्रीजेस आवर ब्लड शुगर लेवल्स, बट अ रॉ मैंगो वोंट। But if your diabetes is under control, then you can have probably 2 fruits a day. There are a lot of options and varieties of fruits that you can eat. So like, apple is good for you. Apple is a complex carb also. It gives you strength for a longer time. Then banana is high in sugar, but then you can eat a pear, you can eat a guava, you can eat papaya. Papaya is great for you. It's an antioxidant. You can eat oranges, blueberries, blackberries, strawberries. These are very, very good for your heart. So these are the things that you can have easily. So now you have to decide what you want to do with your life, how you want to live it, and whether it's worth making the effort or not. So exercise, and then sleep is very, very important. You have to sleep, get 7 to 8 hours of sleep every day. You please make sure and have a routine in your life. Make sure you sleep on time and you wake up on time. Like our parents used to say, days are meant for waking up and working, and night is meant for sleeping. So please don't keep watching TV at night. And it's my humble request to everyone कि आप जब खाना खाने बैठे, आप टीवी के आगे नहीं बैठे, आप नेटफ्लिक्स चला के प्लीज खाना मत खाएं. That is the worst that you can do to your system. What you can do is sit on the dining tables. When food comes in front of you, please be thankful to God for the food that's come to us and the nutrition it's going to give us. And then when you're eating and just concentrating on eating, you will be enjoying the food, you will be tasting it, and you will be chewing it properly. So chewing it properly really helps because it helps in the digestive system. It doesn't put a lot of load on our digestive system. And again, everything, when you're mindful and if you're chewing it well, then your portion sizes will be controlled. Like, even if I say, yes, you have to up your protein intake, you definitely must, but then you can't go all out. So please be mindful. Please make sure of these small changes. And then there are few things, after your meal, after every meal, if you walk, just, I'm not talking about brisk walking. Exercise is completely separate. Exercise is 30 minutes a day. This is just strolling around the house, just walking, but not lying down. If you start doing that, you'll see the change in yourself. You'll see that you blunt your sugar levels, and it will definitely make a change in your diabetes. Your sugar levels will come down and you will feel much fitter. And maybe it leads to lesser medication, and maybe it leads to better health. What better than that? Once you have this disease, there are few deficiencies that enter our system. Okay, so vitamin B12, vitamin D3 are two deficiencies are very common, which are common in diabetic patients. So please keep getting your parameters checked. Get your blood work done. Get your HbA1c done once in 3 months. And please consult a doctor. If you're low on supplementation, so please start vitamin D3 and B12. Even there's this micronutrient called chromium, which is very helpful in diabetes. So chromium is easily available in onions. All of us have onions in our diet for in raw salad form. But a small tip here also, if you would add a few drops of flaxseed oil, the cold pressed flaxseed oil to onions, the absorption of chromium by the body is much greater. So please, this is anybody who's diabetic or pre-diabetic, please start by doing this. It will really help you. Thank you, Health Quadrant Plus. Thank you so much for giving me this opportunity for talking about this thing. That it's really great to be here with you people. Thank you. I'm okay to take questions, please.
Okay, maybe we can go over the questions. So first thing is, what strategies can help manage diabetes in a busy lifestyle, such as eating out or traveling?
See, yeah, if you're eating out and traveling, make sure you carry nuts, or even if you're in the flight, they come with you with opt for good fat, opt for nuts and seeds, and always try and start your meal with a salad. It really helps. And then, always read the labels. It's very good if you read the labels. Anything that has trans fat or it's high on sodium and potassium, you should be wary of. Here in India, we have health foods all proclaiming to be very good and low on fat, but they have so many of these hidden things, which they have palm oil, they have added sugars, which are really not good for your system. So we should just try and add more of veggies to our diet.
And I think also, to add to what you said, when we travel, we tend to explore the cities and all so much. So it's so easy to include more walking. And I think everybody should be able to do that.
Absolutely. That's the best. I think movement is what our body requires. We should fall in love with movement, any kind of movement that is.
Yeah. Okay. Next question. How does protein help in diabetes?
See, in diabetes, diabetes is not only about our body's inability to metabolize carbs. Slowly, our protein metabolization is also impaired. So that way, people with diabetes tend to lose a lot of muscle mass. So, protein, to digest protein, it takes many more calories. The thermic effect of protein is quite high. So that way we become calorie deficit, which is great, and we increase our muscle mass.
Great. Next, how does stress impact diabetes, and what role does stress play in, I mean, what role does it play when it comes to, the proper management of stress when someone has diabetes?
Stress has been shown to increase your diabetes level a lot. It has been researched and it's shown. You will see most of the people who turn diabetic have gone through a very stressful 5-6 years of their life. If you can manage stress through meditation. In stress, your cortisol levels go up, they shoot the roof. So that is the reason why then your hormones are haywire. Insulin is a hormone, anyways we are struggling with insulin resistance. So then diabetes, your sugar levels, anytime you're very stressed out about something and you check your sugar levels, they'll be really high. So what you can do is you can meditate, you can listen to songs, and you can just think, is it worth it? Is it worth giving my body so much trauma? And you'll decide, no, definitely not. Let's just try to lead a stress-free life and manage it.
So it's more about looking inward as to what is causing us stress.
Absolutely. Diabetes, and the way to manage diabetes is only about looking inward. You have to be so mindful. And diabetes is one disease, it's not one size fits all. It's like you have to see what works for you. Like I have seen with my clients, like papaya is supposed to be great, but in one of my clients, the sugar spike is crazy when they have papaya. And oranges are great for somebody. Mangoes, there's some people where mangoes, don't create a sugar spike. But some people, most people, because they have a high glycemic load, they're supposed to be off mangoes.
Yeah. Okay. Next, how does fenugreek seeds, soaked fenugreek seeds, and ACV help in diabetes?
Yeah, see, it's a traditional approach. Earlier, it was there, you soak fenugreek seeds and you have the water in the morning, and if you would have fenugreek seeds, so it would control your diabetes. So this hasn't been researched, but it seems to work for some people. So I would say, please go ahead and try it. Like I said, it is all about looking inward. You try it. If it suits your body, please do it. At least there's no harm. Fenugreek seeds will not create any harm. Again, eaten in moderation. ACV, I don't know. I don't think it has anything to do with diabetes. But yes, it has shown to have some impact on weight loss. So people who are looking for weight loss, and because in diabetes, weight loss always helps you. If you're obese, your diabetes level will go up. So ACV, having 10 ml before a meal might work.
Okay, great. I think that was all the questions that we had.
Okay. Thank you so much, Priya. Thanks for the wonderful introduction. It was really
nice. We all learned so much from you today.
Thank you. Okay.
Are we good to wind up, Shakti ji? Not sure.
Okay.
Anything else from the
Yes.
audience?
Yeah, let's,